Formé Medical Center in Urgent Care. And I am here, number one, I want to thank the Westchester Medical Center Health PPS Program. Without you, we would have had a really hard time becoming a medical home facility. I remember when you first stepped into our office and you challenged us to become a medical home, and this was something that for many years I have over 30 years in the healthcare field and 26 working at a very prestigious practice, and we did become a medical home, and it was a dream of mine to be able to do the same for Formé Medical Center, my own place. And we did it in 6 months, and my staff was telling us it's impossible, we cannot do this. But I knew that with the support that we got from the district program, we could do it. You gave us the possibility of training our staff, training our doctors. The support that we've received from the team has been invaluable. Thank you for that. I am an immigrant. I was born and raised in the Dominican Republic, and I had the privilege of come to this country and create an amazing career in healthcare. And I saw what the right healthcare system can do for the community. And I've decided after 26 years in 2015 that I could no longer stay with my amazing job, making a lot of money. A lot of people thought I was insane, that I was leaving an amazing career where I thought I would retire. I knew my family was not as privileged, and many of my friends and many of the immigrant community that I knew needed a place where they can get affordable access to care, affordable with dignity and accessible. So I was blessed enough to find my partner Gina Capelli, who had created the foundation for Formé Medical Center. And we joined forces together on a mission to take care of the underserved, uninsured community with a high focus on the Latino population. Being a Latina myself, I realized that we needed to be culturally sensitive, in that myself as a Latina understood the need of this community. And we take on this journey of creating a place where they can get access to urgent care. We're open 365 days a year. We have created a program for the uninsured population that is in much need and not many people are paying attention to, especially our government. This population needs health care, and they are able to pay, but unfortunately many of them are not able to get access. So with this in mind, we created a medical membership, and this medical membership gives them access for a very low fee a month to the urgent care facility. It gives them access to primary care, GYN. It gives them access to physical therapy and mental health. And I am extremely proud of being able to create this practice for our community, and my plan is to someday be able to take this national. I realized that this is a huge mission that I was taking on with my business partner, Gina. And we decided, and I am somebody that never believed in social media, I decided after not having Facebook, Instagram, or anything, LinkedIn, I decided that how am I going to be able to reach the masses? So I've become a social media expert. And from today on, you will be able to follow me, because I realized that social media has the power of giving us access to the masses. And I decided to take on, I have my own Facebook Live show, and I do one in Spanish and I do one in English. And my show is growing, and the idea is, how can I bring information to a community that needs it, that doesn't have access to many of the information that we take for granted, that we feel they should know. Well, they don't. So, Reflexiones con María every Friday at 1 o'clock is getting a movement. And I bring organizations like Alzheimer's tomorrow on Friday. I have the Alzheimer's Foundation coming, or association coming to, in Spanish, to communicate with our community. I had them on Monday with Reflect and Reset with Maria and Gina. And people tell us, you know, I can't believe you find the time to do all these videos. We're obsessed. We're obsessed with the mission. We're obsessed with the mission to provide education to a community that we've been complaining about. But what we don't realize is that this community, it's a community that needs the information. Preventive care. Preventive care, it is something that we take for granted. I can tell you in the United States, we talk about preventive care. Dominican Republic, no. We don't know, we don't tell you that you're supposed to have a mammogram at the age of 40. We don't tell you if you have breast cancer in your family. We don't tell you that you're supposed to have a physical exam. And I know I have 1 minute left, so I am going to, I can talk forever, so thanks for listening. And I want to tell you that it is an honor for us to be sharing our mission with all of you. And now I would like to share a short video of the great things that are happening at Formé Medical Center. Thank you.
There's over 29 million people in the United States without insurance. In Westchester alone, there's about 183,000 people from the census of 10 years ago that don't have insurance. And this is a community that actually is a working community.
But we do have access to an enormous amount of services, including laboratory, radiology, cancer prevention screenings. We have specialists that come here on site, and we can do things at a much more affordable rate.
Because now you get access to a primary care doctor, you get your physicals, we push for physicals, preventive care, it is key, it is my passion. Last year we did 700 physicals on people that never had physicals before. It is a major impact that is already happening.
The biggest challenge is getting people to take their illnesses seriously. The biggest problem that I always face when someone comes in who has very poorly controlled diabetes, high cholesterol, is high blood pressure, I felt fine. But when you have pre-diabetes, I feel the most satisfied. I'll have the patient come back and we'll sit down, we'll have a conversation as to what it means, and I understand you feel fine and you don't have any symptoms, but this is the road you're going down, and we need to stop it because we can stop it. That's where I feel the most satisfied, is catching people in that early stage before anything happens.
To be able to work with, through the DSRIP program, working with Westchester Medical Center, to be able to have a case manager that it is managing our sickest patients, our diabetic patients that need to make sure that they go to the doctor, that they go to their follow-up appointments, that they go see the podiatrist. We are assisting them in care coordination for our patients, especially the underserved community.
Lisa became my patient because I was doing a telephone outreach to patients that had chronic conditions and come here. And when I called her, I introduced myself and I told her what my role here at Formé was as a care manager, and discussed some of the services that she may benefit from if I make some referrals for her. She liked our conversation and agreed to come in and meet face-to-face. One of the things that we are working on with her now is her diabetes, and we've made referrals to a nutritionist and an endocrinologist.
Senior is a very nice She have a passion for me, and she work with me a lot. First of all, they look for my doctors, my eye doctors. I got surgery, and my eye is good, and the gynecologist.
So we've been working with Zinnia, and at first I really didn't know what her role would be, but very quickly I came to appreciate it, love it. She'll go into the patient's chart. She'll find the high-risk patients. She'll see them before I even get in there. Sometimes she'll call them on the phone before they even come in for their office visit. And she'll begin to have a conversation with them and you know, talk about screenings that they need.
I created a care plan for her with goals. She was feeling depressed and she wanted to be connected to a mental health provider. And then I discussed MHA of Westchester Health Home and that she would benefit from it. She agreed to the services, signed the consent, and she was assigned a care manager at MHA of Westchester.
And they recommended my psychologist, and I've been seeing him for I think 2-3 months. Yes, because he helped me a lot, and I feel now a little relaxed. I was needing somebody listen to me. I feel good. And mentally better than before.
She sounds just happier. She's being heard. She's being understood.
A lot of times I didn't know where to send patients with mental health issues. Some people would come in just, you know, asking, you know, whether it's they're depressed. Other people do have real psychiatric issues. And Zinnia always knows where to send them.
Our community thinks that the emergency room is an office, is a doctor's office. We need to educate them. We need to help them understand that urgent cares are there to fulfill the need of when you're sick.
So we can keep people healthy enough that they're not running out of their medications, that they're doing the testing that they're supposed to be doing. We can keep people healthy and out of the hospital.
My vision was that I needed a beautiful facility, that as soon as the underserved community will go into this facility, that they will see that the higher expectations for them was there from the beginning. I happen to have had a few conversations with people that work at Westchester Medical Center, and I realized that the passion for helping the underserved community, I felt a stronger connection with Westchester Medical Center. And the district program has been altering the healthcare that we're providing at Formé.
Senior, I love the way you work with me. Yo te quiero mucho porque han trabajado mucho conmigo ellos.
Introduce